Y'all, this lighting is not. Alright, welcome to my mess of a vlog. Okay, so basically I'm starting this page because I'm on a Facebook group that's like a support network for people that have had colonic inertia and other motility issues. It's called Colonic Inertia, IBS-C, and Other Chronic Colon Motility Issues. And there are 1,000 members, and I'm pretty sure they're exclusively women. I apologize if I'm incorrect. But it seems that these kind of motility disorders only affect women. And they don't know why, because not enough people have it, so there's not enough research on it. It's just part of being a woman. But, so I wanted to start this YouTube page or channel or whatever, because sometimes when I will post a question on there or a comment and I say that I had a colectomy, now it'll be about 1.5 years ago, I get like a lot of DMs from women that have not had a colectomy and either are considering it or didn't realize that was an option, and just questions about how I got there and what my symptoms were and how I got my diagnosis and how I ultimately chose to get a colectomy, because that's a really freaking big deal. And so yeah, like I have no problem answering those questions individually. I just thought it would be better to come on here and kind of answer things collectively and broadcast them so that, you know, I'm not getting the same questions. Or if people aren't comfortable asking or whatever, they can just get on here and learn from what I've been through. I do want to start out by saying that obviously I'm not a medical professional. I'm just taking what I've learned from my experience and just kind of giving personal advice out to you all if you're struggling with this right now, if you're going through the diagnosis process or you're not even there yet and you're just having all these weird symptoms and you can't poop or whatever, or you're throwing up all the time. I'm realizing that I say a lot when I do public speaking. Okay, I'm gonna start this video. It's just gonna be me kind of telling you how my symptoms started out and how they progressed, and just kind of vertically telling you the testing processes I went through without going into detail in this video, just kind of what my overall experience was so that you kind of know the gist of my story for this intro video. You know what, I just filmed like a bunch of stuff on my overall story and I realized I'm telling way too many details for the first video and I'm making this way too complicated. So I'm gonna try this again and just list things out. Okay. So, summer of 2015, I started having some problems with constipation off and on. Thought it was like traveler's constipation. Fall of 2015, 30 minutes after I would eat, I would get this like sharp stabbing pain kind of in my solar plexus area and didn't know why. That's about all that was. That happened for about 3 weeks and then I went to the doctor. They said, oh, it sounds like you have acid reflux. They gave me omeprazole. I felt like that helped a little bit. So that kind of went away. And then late fall, like Thanksgiving time of 2015, my constipation started getting noticeably worse, where I wasn't going for like over a week, even though I was eating the same as I always had. And I started slowly, every once in a while, would regurgitate the food I ate and did not know why that was happening. So that would be like once a week I would regurgitate something. That was Thanksgiving time of 2015. And then over winter break, that got progressively worse. Till early spring of 2016, I was regurgitating everything that I ate, intermittently, I should say. And it was regurgitating, it wasn't vomiting, because it was undigested. And I would notice things that I'd eaten 7 hours prior that I would regurgitate. And that would happen again intermittently, but total about 4 to 5 hours a day. And I was very constipated and I would spend another 4 hours a day trying to defecate. Generally, I could not without the help of all sorts of laxatives or trying to use enemas. And so my spring semester of 2016 was probably the hardest time in my life, and it was like a full-time job throwing up. It was to the point where I would bring like an opaque cup to my classes so that I could regurgitate in there with nobody noticing and still go to my classes and do everything I needed to do. Spring break of 2016, I was fed up. I went to the emergency room because I was kind of freaking out. I was like, what if I have stomach cancer? What's going on? And from that, I stayed in there for like a night, and they ended up doing an upper endoscopy, which is where they take a camera and look at your stomach, and everything came back as normal. From there, that summer, I did a HIDA scan, which is checking your gallbladder, and I did a gastric emptying study, which is where you fast for about 12 hours before the study, and then you eat this food that has some chemical element in it where they can, I want to say radioactive, but that's not right, where they can take an x-ray and see how your stomach is digesting the food, or see how quickly it's digesting the food when they take an x-ray. So did those, and those both came back as negative. During this, my gastroenterologist in my hometown tried to prescribe Linzess. I tried that, and it made things more liquidy in me, but it did not help me expel anything. So I tried that for a few weeks, and I had no success. I know it works for some people, but it was not successful for me. I started having to blend soups and just eat soft foods because I was losing too much weight. I brought my vomiting down to about 2 to 3 hours a day instead of 4, eating blended foods. And then my next test was it was for achalasia manometry. It was an esophageal manometry, I believe is what it's called. Some sort of manometry where they go through your nose and then down through your stomach, and you have to swallow it 10 times, and they basically mark how strong your swallows are and how quickly your esophagus is bringing things down. That one was basically a test for something called achalasia, and that came back like with mixed results. It was a little abnormal but not alarming. So it wasn't enough to diagnose me with achalasia yet, and that would not help with the constipation, but that could explain the regurgitating. So that was the next test I had. And then kind of waited a while, and after that I was still losing too much weight, so I ended up switching to drinking only Ensure and Boost, which are nutritional supplement drinks. You might know about them, but I realized I could survive on only liquid, and I actually gained 5 pounds by doing that because I wasn't throwing up quite as much. I brought my vomiting down to about 1 to 2 hours a day, so that was actually really, really nice for a while. Well, that's where I was at by fall of 2016, was only drinking liquids. I ended up doing that for a total of 8 months. And so yeah, then fall of junior year started. It was pretty miserable. My next test, I believe, was Barium Enema, which was my least favorite test. They basically take a cement-like paste, inject it through your rectum, and do not only fill up your rectum, but fill up your entire colon while you're not sedated at all. That again came back negative and normal. I did the esophageal manometry again, and that one came back even more normal than the first time. So didn't have achalasia. Now I believe we're at winter of 2016. And just kept doing my thing, trying to poop, and drinking only liquids. And then January of 2017, I finally went up to Mayo Clinic with my parents and got some tests done there. I got the pelvic floor test, the first test they give you to see if they're going to diagnose you with pelvic floor dysfunction. And I did the whole sitting on the sensor thing, and about after a minute they were like, oh, your muscles are still super tight, so you have pelvic floor dysfunction. Great. We have this 2-week inpatient training program or outpatient training program, and we can do biofeedback and we can get your muscles to relax, and then you can poop again and everything will be great. And I was like, oh my gosh, so cool. So we scheduled that for the summer of 2017. So when I was there and got the pelvic floor diagnosis, I also went to check on my esophagus, because maybe they were two separate issues. And when I talked to that doctor at Mayo about the regurgitating and everything, they ended up diagnosing me with something called Rumination Syndrome, which is basically all psychological, and it's just you have a lot of anxiety, and maybe you have a lot of anxiety around food, and you regurgitate, and it's subconscious, but it's all due from mental health. It's nothing that's physically wrong with you. It's all in your head. So that's what they diagnosed me with, and basically they sent me home, get ready for the 2-week training program this summer, and here's a bunch of pamphlets on how to breathe when you're eating, and maybe you need to go see a psychologist, and get your anxiety down. Just swallow, take small bites, and breathe, and then you won't regurgitate. And I was like, okay, I don't think I'm anxious about food, but whatever, you're Mayo Clinic, right? So I tried to do that. The breathing exercises and bringing my anxiety down was not helping the regurgitating. And I waited, and I went to the 2-week training program at Mayo Clinic that summer. I lived in Rochester for 2 weeks, did the physical rehab program, and after the end of the second day, I was very certain that was not my issue, because I was doing the biofeedback and I got the sensor down to relaxed immediately, and it was fine. But my nurse was like, no, we'll just, it'll take some time, it's fine. And so I went through the 2 weeks and nothing changed. And so at the end of that, I had some more tests done. I had one more test done then. I forget what it's called, but it's where they inject a gel into your rectum and have you defecate on the MRI table. And I did that. Basically, that one shows how your pelvic floor muscles are working. It's just a much more invasive test than the sensor. So I did that, and they're like, oh, just kidding, your pelvic floor is fine. So that was great. And yeah, so I wasn't happy with that. And then at the end of the summer, I went back to Mayo Clinic, and I got a colonoscopy and a smart pill study. My colonoscopy, I came back as mostly normal. There was part in my ileum that appeared to be a little scratched, but other than that, my colonoscopy was totally normal. My colon looked healthy and normal as far as the tissue goes. And then I had a smart pill study, which you swallow a pill with a camera, and it basically measures how fast it goes through your small intestine. And that was normal too. So at this point, I'm up to God knows how many tests. I'm too lazy to count. And they were all normal. So I started to really, really, really think that this was all in my head. And obviously it was really happening, but the doctors were telling me I just had too much anxiety, and I had a history of depression, and I struggled with anorexia when I was a preteen, and they were like, well, this might just be a mental health thing, and you're just too stubborn to see that, or you just can't objectively look at yourself like that. And for a while I was sure that it wasn't, that it was physical. And then at this point, after 2 years of all these tests coming back as negative and normal and like a normal healthy human being, I started to really, really think that I was not sane. And then I just started to question everything I felt. So finally, winter of 2017, I went and saw a colorectal surgeon in my hometown, and he ordered me to take what's called a Sitz marker study. And basically it is like gotta be the cheapest of all the tests that I had taken throughout all of this. And you swallow like kind of a horse pill, and it has little plastic rings inside of it. And then you swallow that pill, and 5 days later you go take an x-ray of your stomach to see. A normal person should have expelled that pill by then, and they see if there's still rings left inside of you. And if they are left inside of you, then you have motility issues, and it can show where you're having motility issues. So I did that, took the pill, went and got the x-ray, and when I got the x-ray, which nurses are not supposed to do this, but I was getting up to leave, and the nurse was like, okay, we took the pictures. It looks like everything's good, but you can go. And then I was like, what do you mean everything's good? And she's like, it looks like you've got all the rings out, and, you're good to go. And I started basically panicking, and I was like, no, like, this is like the last test that there was that I could take. And I was like, this has to be my answer. This test can't be negative. And she was just like, I started to cry, and she was like, well, there are lots of other tests, and you'll be fine. You'll figure out whatever's going on. And I was like, no, you don't understand. I don't think there are any other tests I can take. And I left, and I got in my car, and I just like, at that point was convinced I was just insane. And because I didn't even remember, I was like, I didn't go to the bathroom. Like, those rings have to be in me. I didn't defecate. And I just was like in my car and like screaming and crying, and I was just so done with it. I got home, and my mom and I cried together, and I was just really, really down for a while. But my mom was like, let's just wait. Let's go to the doctor. He might have, like, go back to that colorectal surgeon. He might have some other tests that you can take. And I was like, because I've researched so many medical journals during this time, I was like, there's no other tests I can take. I don't think. I don't know. At that point, I was convinced there were no other tests I could take. So I went to the colorectal surgeon, back to his office, and I was just down, obviously, and I was just waiting for him to be like, okay, well, this test is negative, blah, 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 you're fine. And anyway, he came in, puts down the folder, and he goes, well, you failed your test. And I was like, yeah, I know. Because in my head, failing was being normal. And I was like, yeah, I know. Wait, I failed? And he was like, yeah, the test came back positive. You still had rings left in your sigmoid colon. So basically from that appointment, we decided, I told him then and there, I was like, okay, then I want my colon out. He told me I had something called colonic inertia. We had to do one more test to make sure my rectum was okay, which was the defecography, the x-ray defecography. I had to do that, but as long as that came back negative, as long as I passed that test and my rectum worked, then it meant I had colonic inertia and I was a candidate for a colectomy. And so I did that test. I passed that test, defecated that gel out. My rectum was fine. So I went back to his office. He said, okay, you are a candidate for a colectomy, but surgery is extreme, and so I want to try you on Trulance first. I know you've tried Linzess, but I want to try you on Trulance, which is another motility medication, to see if that kind of wakes up your colon. So, and that was, I didn't want a colectomy while I was still in college anyway. I was going to graduate in 6 months. I was like, okay, I'll do this medicine while I graduate, or while I'm getting ready to graduate, and if it doesn't work, I'm getting this thing taken out in June or May or whatever. And so I went home, he prescribed the medicine, took it for a few weeks, didn't help, did make me nauseous sometimes. You gotta take it with food if you do take it. But it didn't help with motility. So I went back and we scheduled my colectomy for May 15th. And he told me I was a candidate for a total colectomy with ileorectal anastomosis, which means they take out all my colon but leave the rectum so that they can attach my small intestine to my rectum and I can defecate normally. He did say that I shouldn't need an ileostomy bag or a colostomy bag, but if the surgery went wrong or if something happened, that was a possibility, and he had to make sure that I was okay with that possibility. And I had thought about it a lot because I didn't even realize that I could keep my rectum if I got my colon taken out, because not everyone can. And I was like, absolutely, that totally improves quality of life from where I have right now. It's not ideal to have a colostomy bag, but it's better than not functioning. And so I waited, I graduated, I had my surgery, and 24 hours after my surgery, I went to the bathroom because I thought I needed to pee. They had taken out my catheter, waddled to the bathroom thinking I just needed to pee, and I just shat like a ton. I mean, it was liquid, but I just went. And I came back to the hospital bed, and I got in the bed, and I just started sobbing. And the nurse came over, and she was freaking out. She's like, are you okay? Are you okay? What happened? And I just grabbed my mom's hand, and I was like, yeah, I'm fine. I just went to the bathroom. I just pooped, which I hadn't done in 3 years without medications and pain. And it was just the most amazing thing. And I waited 3 years to feel like that, and all these tests and all these doctors telling me I was crazy. And basically, long story short, that's why I'm making this vlog, I guess, because I know a lot of you are going through it, and not everyone is going to have the exact same diagnosis as me. Trulance may work for some people, and some people may need a colostomy bag, whatever, but I know a lot of women, and again, I apologize if there are men that are having this problem, and please let me know, because I'm just not familiar of any from that Facebook page. It seems like it's all women, but don't let doctors get you down just because they're not familiar with it, because it's not a very common thing. It's not something they see all the time. They see variations of it, and they see other digestive issues, but if you know your body better than anyone else, and if you believe that there's something wrong, and if you look at yourself and your body objectively, and you truly believe that there's something wrong that they're not seeing, then keep looking for it and don't give up, because there is something that will get you an answer. With how far medicine is now, they don't know why colonic inertia happens, but there was a surgery that I could have, and it made my life a billion times better. Things could still go wrong, but a year and a half later, my life is just, it's so pretty much normal. It's so close to how it was before I got sick. And technically even better, because I just have a greater appreciation for everything, and I don't freak out as much when I feel like I'm gaining too much weight, because I can gain weight. I didn't even have that option before because I couldn't eat. So I'm just here to make videos and answer questions. And again, I'm not speaking professionally, I'm speaking from my own experience, but I just want to help any of you out as much as I can. Also, I apologize for my stream of consciousness, possibly out of order monologue. I'll try to outline it better next time, or allow myself more time to film and more footage to edit. But for now, this is what you get.